Good morning and happy Wednesday, everybody. I hope everybody's having a wonderful week and month, first month of the new year so far. I am here to give you our 2-minute skincare drill. And for those of you who are popping on for the first time, my name is Claudia Cometa and I am a pharmacist and independent skincare consultant. And I come here every Wednesday to provide you tips, tricks, and education to achieve the best skin of your life. So as you kind of know, I like to vary up the topics a little bit, and sometimes I'll talk about specific ingredients, sometimes I'll talk about a little bit more of a comprehensive approach to skincare. Today I'm going to talk about what your skin, which is your largest organ, might be trying to tell you. So this topic could certainly go on for a much longer period of time. As you know, I try to keep this between 2 and 4 minutes. Typically I'm maxing out at 4 minutes. So we're not going to go over every possible scenario. I'm going to go over 3 that are pretty common and just kind of go over what your skin might be telling you about what might be going on beyond what you'd see. So, and again, I'm going to be using the words might and may a lot just because I want you to be clear that I'm not attempting to diagnose you or your friends or family members. I'm trying to provide you education to empower you to look a little further and ask a few more questions of your healthcare provider, those types of things. So for 3 things that we're going to cover today. The first is eczema patches, dry, itchy, eczema type patches on your skin. What might that be saying? So if you have eczema and you know you've been diagnosed with that and it continues to be a problem, you might be treating that effectively with a topical steroid or another type of immune regulating product or calming type of a skincare product. However, which is perfectly fine and it might be working. However, if you're noticing that you are needing that all the time and that's not resolving, it may be a symptom of something a little bit deeper, which might be an allergic reaction to something. And that could be an environmental allergen or it could be a food allergen. So you might be, and again, might be allergic to something in your environment. That might be something you're coming into contact with, or it could be something that you are consuming in your food. So ongoing eczema problems that are requiring long-term topical steroids, I would be asking the doctor about, if you have not already had allergy testing, to look into that, because it may be something relatively easy to avoid and that eczema problem may go away on its own by taking away the cause rather than just treating the symptom. So eczema, this is huge also in kids. So when they're young, before they even had solids, if we're talking about infants, if there is an ongoing eczema problem, I would definitely, and I'm speaking from definite personal experience, I would be asking about the potential for allergy and allergy testing. All right, secondly, darkness under the eyes. So if you are somebody who has historically had problems with darkness under the eyes, or if it's just popping up now, so if it's an ongoing problem, it could be hereditary. So that can be, you might just have more pigmentation there from melanin, but it could be a couple other things. It could be extreme fatigue. So it could be that you're sleep deprived, and that might be your body just telling you to pay a little bit more attention to the hours of sleep you get at night. It could also be allergies as well. So you might have heard the term like allergic shiners. Darkness under the eyes can be a sign of allergic type symptoms like hay fever. So again, another potential indication to look into the possibility that there are some allergies present. So darkness under the eyes. Lastly, just to kind of keep this concise, is wounds that won't heal. So if you used to get, a paper cut or maybe something a little bit deeper, and that would heal up really quickly, slap a Band-Aid on it, and it's healed in a day or 2, but that's no longer happening. So it's taking a longer time for the closure of that wound. A couple things. One might be there might be an infection present, and you would notice that by some redness and swelling in the area as well. Or it could be a sign, again, it could be a sign of diabetes. So your blood sugar might be high and you might not know it. That is going to result in a lot of times in slower and poorer wound healing. So look into those things. These are just potentials for you to be educated on, to know that your skin is an organ and it talks to us, not verbally, but it tells us that something else might be going on. So pay attention to that, pay attention to your body, and definitely to your skin. Have a wonderful rest of your week. I hope that was helpful. Please share it with anybody who you think it might help, and I will see you next week.